The government's been warned that its advice for carers who visit vulnerable people in their own homes is outdated and not clear enough about what they should do if they think that their clients have caught the coronavirus. One social care organisation has told this programme they've been left exasperated by the government's approach. From Sutton in South London, our political correspondent Ross Hawkins reports.
This is to do with the current virus, is it?
At his home, 83-year-old Robin Way is taking what precautions he can against the virus.
We don't shake hands these days, do we?
Hi, Robin. I'm actually coming to see you on Friday.
Yes, 10 o'clock.
Because he relies entirely on carers coming to him.
Shona's team, it will cause me a problem because I can't get into bed without their assistance.
And some of the team, run by Shona Kendall and Mike Smith from Trinity Homecare, worry about the best thing to do if the people they look after, like Robin, are diagnosed or just suspected of being ill with that virus.
If a client starts to present symptoms, they go through the 111 process and they are told to self-isolate. Who is going to look after them? And then what does that mean for the rest of my workforce if they've come into contact with that individual?
What should his workforce do, they ask, if a vulnerable old person cared for at home is diagnosed with the virus and can't be looked after in hospital? Doing nothing isn't an option.
We cannot leave people on their own. And this, for me personally, has not been covered. People have not really thought about it because you can't say to someone who's bedbound, "Well, sorry, we'll see you in 14 days' time."
There is government guidance from February for care staff travelling between clients like Shona, advising them to call 111 if a coronavirus case is possible. But that guidance isn't long or clear enough, says Colin Angel from the UK Homecare Association, and needs urgently updating.
So we're going to need much more specific advice that will help care workers on the ground when they're in somebody's home know the right action to take and to act consistently with public health guidance.
He told government officials as much yesterday and says they are listening. Others, though, are running out of patience. From Care England, a charity that speaks for care providers, Chief Executive Martin Green.
I'm exasperated because we were told that we were going to see a Department of Health and Social Care that was going to encompass the needs of both bits of the system. I've seen no evidence in this planning process that social care is anything other than the secondary bit in their considerations, and that has got to stop.
Well, change is coming. The Department of Health told me updated guidance will be published this week. They're working with councils and care providers to make sure the sector's prepared, they say. But the well-being of vulnerable people living in their own homes still plays on the minds of carers and of their clients.
If we can do as much as we can, and we will do as much as we can to keep you safe, because I know it's a little bit of a worry for you.
That is the thing, yes. My safety. I've been around for 83 years. I like to see 84.
Absolutely.
That report from Sutton in South London from Ross Hawkins. The time now is 7.